Pregnant during the pandemic. Welcome to SBH Bronx Health Talk, produced by SBH Health System and broadcast from St. Barnabas Hospital in the Bronx. I'm Stephen Clark. According to the CDC, pregnant women are at an increased risk for severe illness from COVID-19. They're more likely to be hospitalized, to be treated in an ICU, and to need a ventilator. Additionally, they have an increased risk of adverse pregnancy outcomes, like preterm birth. With us today to discuss this is Thet, a midwife at SBH, who also happens to be pregnant. Welcome, Sue.
Thank you.
Let me just start out. Before we get to the focus of today's interview, why don't you start by telling us a little about the training and day-to-day responsibilities of the midwife?
Absolutely, and thanks for having me today. So I am a midwife, and I got my Doctor of Nursing degree from Columbia with a specialization in midwifery. And I have started working at St. Barnabas Hospital in the middle of the pandemic in April of 2020. And so I attend births, hospital births. I have a L&D shift once a week, and then I also have clinics where I see, patients from 9 to 5, 4 days a week.
I guess it's a misconception that you only deal with pregnant women, right?
It is. So midwives provide primary care to all women from, until menopause. Primary care, we do preventative care, we do pap smears, we do annual, screening, GYN, family planning, all of that, including, antepartum, intrapartum, and postpartum.
I understand that you didn't start out as a midwife, right? You were a nurse, and then eventually you evolved into becoming a midwife? Went back to school, I guess?
That is correct. So I was a labor and delivery nurse for 10 years. That was in Long Beach, California. And I've always loved taking care of women in labor, and I always feel like I could do more, and so I went back to school to get my advanced degree. And I love all aspects of midwifery, including the support of physiologic birth, as well as using evidence-based practice. So I feel like I'm doing the best of two worlds.
Okay, so let's get to the most timely question. Should pregnant women get the COVID-19 vaccine?
That's the million-dollar question, Steve. Experts are saying that we don't know, which is very confusing for public. And I think that it is very important that pregnant women speak with their healthcare providers, because it depends. It comes down to a personal decision. It really comes down to assessing the risks, like what is her exposure, what is the risk of exposure to COVID, what community does she live in, what is the COVID rate in the community that she lives in, is she a frontline worker, a healthcare worker, does she work in the grocery store, where she at more risk for being exposed to COVID. Those risks needs to be weighed with the theoretical risk of getting the COVID vaccine, and so that conversation needs to be done with a healthcare provider, and then it really comes down to the personal decision, and then that personal decision needs to be supported by their healthcare provider.
Now, you told me that you have or plan to get a vaccine.
I did, yes. So it did take me a while to come to the decision, just because of the lack of data in pregnancy and lactation. But when I really looked at the data, and then the way it was, the vaccine is made, and then the integrity of it, and when I looked at the data, I feel more confident of getting the vaccine, because I'm a healthcare worker. I'm exposed to COVID, patients every day, potential risk of getting COVID is a lot higher. And so I had to weigh those risks and versus the theoretical risk of getting the vaccine. And I ended up getting my first vaccine last Wednesday. So I'm waiting to get my second vaccine.
Well, what does the limited data tell us about the vaccine in pregnant women, if anything?
There is nothing, because the pregnant women were not part of the research or developing the COVID vaccine. So we really don't know. However, we do know that it is not a live vaccine, which is why it's not theoretically not contraindicated in pregnancy. Other vaccines such as flu and Tdap vaccines are routinely administered and recommended during pregnancy. So it's not like all vaccines are contraindicated in pregnancy. So based on that data of how the vaccine was made and developed, and I've decided that, okay, this theoretical risks are very low and it's not a live vaccine, and I have a very high chance of getting sick from COVID infection. So which is why I personally decided to have the vaccine.
Is there any reason to think the vaccine could be a danger to lactating women, or in terms of a woman's fertility if she's thinking about getting pregnant?
Yes. So in terms of breastfeeding, there is no data that suggests that breast milk is transmitted, or COVID virus is transmitted in the breast milk. But in terms of the vaccine and the efficacy of antibodies passing into the breastfeeding and potentially protecting the baby, that data is not known. However, there is a risk of transmitting the COVID virus to your infant child if you're breastfeeding through respiratory droplets.
What about fertility? Any reason to think
there is no data?
fertility?
There is no data that suggests that it affects fertility.
Do you have many of your pregnant patients, or not, take that back, patients who are not pregnant, who are considering getting pregnant? Do they talk to you about whether this is maybe not a good time to get pregnant?
I haven't had much patients like that. And, I think one reason is because the COVID vaccine hasn't been available to the public as yet. And as far as I've talked to them about it, unfortunately there's a lot of hesitancy, in the community that I serve, in terms of getting the vaccine, and which I completely understand. There's lack of data, and then the misinformation that they're receiving from other, sources, from the internet and all of that stuff, definitely put them at being unease about getting the vaccine. So I think it is, as a healthcare provider, it is important for us to open up that conversation, because she may be thinking about it but not really bringing that up. And I think hey, I think it's important for us to bring that up. And are you consider getting pregnant in the next year? And if you are, what are your risks? Where do you work? What is your job? And are you using universal precautions? How do you feel about getting the COVID vaccine when it becomes available to you if you're thinking about getting pregnant? And I think these are the conversations that, us as healthcare providers should open up about, and talk with our patients.
Well, you mentioned earlier in the conversation that certain women may not be, it may not be a good decision, basically, under certain circumstances. If you live in certain areas, if you have to deal with certain conditions, that maybe getting pregnant during a pandemic for many women may not be a good idea. Is that fair to say?
Well, I mean, I think that it comes down to what the health risk factors are like. We do know that whether in pandemic alone or not, obesity, diabetes, uncontrolled asthma or hypertension, and all of that stuff puts them at a higher risk when they do get pregnant. But it's not, we don't necessarily discourage them to get pregnant because of those conditions. We just let them be aware that these are the risk factors. And when you do decide to get pregnant because of your risk factors, please, come and receive care as soon as possible, as soon as you find out that you're pregnant. And then especially during COVID, I would stress that even more. Do universal precautions, stay at home as much as you can, wear a mask, stay 6 feet apart, wash your hands. And if you, do all of that, the chances are, you limit your chance of getting, COVID infection or getting sick or potentially sicker for being pregnant based on their, health risk factors.
Have any of your pregnant patients gotten COVID?
I would say a handful of them, yes. And then that's because not when they come to the hospital is when they get tested. When I actually see them in the office, there's no universal testing. So, I don't know if they're sick or if they've been asymptomatic or anything like that. But yes, I think that recently I received a report from our St. Barnabas Hospital, a COVID report. I think our percent rate is like 6 point something based on the admission positivity rate. So I do see a handful of them coming back with positive COVID positives and they're asymptomatic and they don't.
Right. Once you learned that you were pregnant, were there certain precautions that you started to take that maybe you were a little lax at before?
I have to say that I've been very vigilant about this PPE situation, and I take it very seriously. In the back of my mind, it pushes me to be even more vigilant and be even more aware, but I didn't change my practice. I wear what the CDC recommended for what PPE should be like: a gown, a mask, and a shield, and gloves, and so all of that I take very seriously.
Should there be any concerns about delivering in an environment like what we have today?
I do understand where the concern would be, and I know I can reassure you that we're taking all the precautionary measures to make sure that the person delivering a baby and also as well as a support person are safe. At our hospital, all our laboring rooms are private. And we all wear, our PPE as recommended by the CDC, and then they all get tested once they're admitted, the patient and the support person. And so as far as our precautionary measures, I feel confident that we're doing all the best that we can to protect our patients, and then also our, staff and, members of healthcare providers.
When are you due?
I am due end of March.
Okay, well, best of luck, and thank you for joining us today on SBH Bronx Health Talk.
Thank you so much for having me, Steve. Pleasure.
I think it was an important conversation. For more information on services available at SBH Health System, visit www.sbhny.org. Until next time.